Hello, this is Dr. Mukhtar Yerima. Welcome to this YouTube channel called The Medical Models. Today, I'm going to be talking to you about psychiatry history taking. You have a patient that has a psychiatric illness, whether you're a medical doctor or you're a medical student or you're a resident doctor, and somehow you have a patient who has a psychiatric illness and you want to take a history. This is how you go about it. So, on this part of the board, I don't know if you can see it clearly from here, but I'm going to say it anyway for you to get it. Before you go to the main history, you want to put a number of things out of the way, and these things include things that you do kind of to prepare for the history, and the things that you need to have, the soft skills you need to have as a clinician generally, not just in psychiatry, in any specialty of medicine. Some of these things I'm going to be talking about are actually important skills to have. So I call them the 3 Ps, right? So these are the 3 Ps. The first P is about the purpose. So why do you want to take this history? The purpose of the history, or the purpose of any history taken in any specialty of medicine, include a number of things, and one of them is that you want to make a diagnosis. Getting a diagnosis is important in the overall treatment planning. The person comes with a distress, you want to name it what illness you're dealing with, and that's why you want to take history. So to make a diagnosis, number two, you want to get to know the context within which this illness occurs. So the context include, maybe does he have any predisposing personality attributes? Do they have any pre-morbid changes in their lives? So we know that some of the things that can trigger a psychiatric illness is if the person or the patient has suffered from a psychosocial stressor before the condition. So you want to get all this context. Are there chronic ongoing difficulties in their life? So this is the context we want to establish when we take history, and it's also important. Another reason why we want to take history is we needed to know the kind of treatment that this person is going to receive. So like I said earlier, you want to know the kind of condition that you're dealing with so that you know the treatment. And not just that, even if maybe you know that it is a particular illness, you want to kind of establish which treatment they will best benefit from. So, and that's why you need to take history. So, for instance, somebody who has had maybe an illness like depression and the treatment has not been effective for some reason, maybe, and he has treatment-resistant depression, you now need to know that he will need a more intensive treatment compared to somebody who has been previously psychotropic naive, right? So again, this is why you need the history to get all that information so that you can do all those plannings. Additionally, you want to get the history so that you can prognosticate this condition. So you want to know whether short-term the prognosis is excellent or long-term the prognosis is guarded or what have you. So as an example, if somebody has had a schizophrenic illness and the illness has been ongoing for 10 years, you know that the prognosis is going to be different from somebody who has had an acute psychotic episode that just lasted 4, 5, 6 weeks, right? So you need that history in order for you to make that prognosis. The fourth reason why we take history is to establish therapeutic alliance, to establish therapeutic relationship. We know that one of the most important indicators or factors that help in psychological interventions being effective is if a very excellent therapeutic relationship has been established between the clinician and the patient. So taking an excellent history and your methodology and your procedure, which we're going to see, is going to help you establish that therapeutic relationship. So this is one of the P's, the purpose. The next P is preparation. So before you take history, just like in other specialties of medicine, you need to prepare. So one of the preparations you need to do is to know beforehand where you want to take the history. Is it going to be in a consulting room? Is it going to be in your office? You need to establish that. Then also the place that you're going to take the history, is it going to be a consulting room in a busy clinic where there are other consulting rooms and where potentially there are patients who might be listening to your conversation with this patient? So you know that confidentiality is going to be an issue, right? So when you take history, the place is going to be very important so that you give the person the privacy he requires and the confidentiality of the information that he's going to give you. Then also put comfort at the back of your mind, the patient's comfort and your comfort when you're taking the history. Then additionally, you want to put safety at the back of your mind because some patients, a very minute proportion actually of patients that have psychological illnesses can potentially be aggressive, and so you do not want to be a victim of those kind of people. So, and that's why the arrangement should be in such a way that if he poses any threat to you, you should be able to easily escape, or there should be a chaperone with you, or there should be maybe somebody within earshot from where you're taking this history. So this is also part of the preparations you need to make in psychiatric history taking. And the sitting arrangement, make sure that it is non-confrontational. Make sure that his seat or his chair is not directly facing you. So you are done preparing, you have known the purpose of the history. Next, you want to look at your procedures or your techniques. So that's the next thing we're going to talk about, the procedure or the techniques that you're going to adopt. So it is very important in history taking for you to use a number of procedures, for you to kind of use a number of techniques. And like I said earlier, all clinicians need these techniques, they need these methods, because that makes you an excellent clinician. So they include, for instance, making sure that you appear unhurried and you appear relaxed. So you're taking history, the patient should not see you looking at your watch every now and then. And also you should not maybe ask a question before the person or the patient gives you the answer. You have hurried to the next question, and so that kind of will not give your patient the confidence that he needs to have in you. So you must appear relaxed and unhurried. Then maintain eye contact, and this maintenance of eye contact should be culturally appropriate. So you should be culturally sensitive to the patient that you're dealing with. There are some cultures that think that if you're not maintaining eye contact, perhaps it means that you're not saying the truth. Whereas there are some cultures in which if you maintain eye contact for long, it seems like, what do you mean, kind of, right? So you should be culturally sensitive when you do that. The next thing is that your body language should be in such a way that it encourages the person to continue talking. So for instance, as the patient is talking, from time to time you can nod your head to suggest to the patient that you are with them. So your body language should be in such a way that it encourages the person or the patient to keep talking. Okay, so you also need to observe for non-verbal cues of distress. There are times when the patient might be telling you something and you see it on his face, you see it in his eyes, and you see it on his body that this person actually is going through a lot of issues. So remember this concept of smiling depressives. These are people who have depression and that they might not want to admit it, and they might even be trying to put up a smile on their face. But if you see the face, you know that this is a forced smile, right? So you should be observant, you should take cognizance of all those non-verbal cues suggestive of distress, and that makes you actually an excellent clinician. Okay, so you're done with this. The next thing is you now want to start the interview. Anytime you want to start the interview with anybody, but especially in clinical setting and particularly in psychiatry history taking, you always want to start with an open-ended question. An open-ended question is a question that cannot be answered with yes or no, right? So you cannot say, have you eaten last night? The guy can say yes or no, and that's a closed-ended question. So always use an open-ended question like, what did you eat for dinner last night? Or asking him what brought you to the hospital today is actually a little bit open-ended compared to, do you have any problems? If you're asking, does he have any problems, he might decide to tell you no. And if he tells you no, you've already closed a door that might probably not be able to open to you unless you make a lot of kind of efforts. So always please start with an open-ended question, and that makes you an excellent clinician. In psychiatry particularly, it's important because you want a rich narrative. You want the person to tell you a lot of things that actually gives you idea as to what's going on in their mind. So that's why starting with an open-ended question is very important. And also please don't ask leading questions. There are questions that would potentially suggest an answer to the patient. So that is also discouraged. Do not ask leading questions and do not ask closed-ended questions. Always ask open-ended questions. So as the history is evolving, as you're interacting with the patient, from time to time it is encouraged to summarize to the person what he has told you so far. That is going to help you do two things. It's going to help you really clear to yourself that you are understanding whatever this person is telling you. And secondly, the patient is going to have the idea that, wow, this doctor has my time. He is actually understanding me. And that's actually where empathy is built. So empathy is not something that you say, okay, I'm being empathetic to this person. No. Empathy starts from this kind of things where the person feels understood, So, and additionally, in addition to summarizing, from time to time, you can paraphrase some of the things he says, and then you can reflect some of the things he says. So this is what is going to amount to what we call active listening. And it is when you practice active listening that you are going to be able to give empathy, or you're going to be able to show empathy to your patient. And that is very therapeutic. That in itself is therapeutic. All right, so you've done all that. We have discussed the purpose of history taking. You have prepared for the history. You have all these soft skills, with you. Now we go to the main meat of the history taking.